Hey, I have an interesting thing to show you. If this patient with very minor lower crowding and very minor upper spacing and a bite that looks pretty reasonable walked into most orthodontic offices and said they would have Invisalign or braces, whatever the orthodontist felt, I think a lot would recommend Invisalign for a case that is so simplistic in a sense because we're not changing the bite around. We're just dealing with very minor things. It's very well suited to Invisalign, although I happen to think aligners are great for a wide variety of cases. Most orthodontists agree that aligners are effective for minor situations. And the reason is that you can really program and dial in very minor movements that really can be realized efficiently and effectively. This, in theory, would only take 8 aligners to accomplish. Now, most people who walk into an orthodontic office for the first time don't have cases that are this minor, but there are some like that. But what I want to share with you is that this is a patient that I actually removed the braces from. This is a mid treatment scan that the patient had braces for about a year and a half. There was much more spacing and much more crowding to start. But in my judgment, at this point in their treatment, while the braces had been on for about 15, 16 months, I remove the braces, and then I am now going to use Invisalign to complete these movements because in my hands, these precise movements are ultra efficient with aligners, and the patient is able to have the braces off earlier. And that's much better, not just for social reasons and comfort reasons, but for access to oral hygiene. And so the reasons why I think a lot of orthodontists don't necessarily think this way is because once you've had braces on, you then may feel like, hey, you know what? Now I'd have to pay Invisalign more money to get this. But for a minor case, the lab fees are pretty reasonable. And you can maybe explain to a parent you may want to upcharge a little bit for this option and let them decide. Or in my case, I'm just going to do it. And one of the advantages I think of going to an experienced provider is newsflash: when you're 60 years old and you've been practicing orthodontics for a long time, you've done okay. And I don't sweat the small stuff. And this is how I grow my practice, with moves like this that really have the patient's interest at heart.